was like a head-to-toe assessment. But my mentor was Mandy Ellerbrook, and she's the nursing manager at Canute Nelson in the short-term rehab center.
So that's her on the left? Or?
That's her, yep, on the left.
You're pointing like,
yeah, on the left.
Okay.
She has 4 kids, and her duties, like, she admits patients, like new patients coming in. She like discharges them and like does like all like the IV medications or like any of the more like RN things. She's very fun. I liked her a lot. We had fun. She's cool. What I learned how to communicate with patients and like patient families. That was a big one because there's some crazy families out there. And then I learned how to work as a team. I learned about different medical procedures and like different treatment options because there's so many different ones, so many medications too. And on Thursdays when I was there, I was with the wound nurse, and her name's Savannah. So I learned about wounds and like how to like deal with like pressure ulcers and like different kinds of like wounds. That was sometimes kind of gross, but the impact it had on me, it just like confirmed that I still want to go to nursing school, and I still am. And actually I have a job there now, so I work there on the weekends as a CNA. And so a head-to-toe assessment is an important step in just getting a baseline of health to prevent wrong diagnosis and treatments. Nurses create a cheat sheet that they use to guide you through the first step of the nursing process, just like get a baseline of like what the person's health looks like. So like the head, you just palpate the head, which means like feel the head, look at the shape, the ears, the eyes, the mouth, and the nose. And then you want to listen to like the lungs and the heart to make sure they like sound good. And you want to watch like the rise and fall of the chest to make sure it's not like too often or too slow. And there's many pulses around your body, like you have your wrist pulse and like your neck, ankle, you have like feet pulses too. Extremities, that's important, like especially with the people that were at the nursing home, just because they don't have as good like circulation through the body. So like check to make sure they're symmetrical in size and length, and like look at the muscles, the bones, joints, and like reflexes. I don't think that's how you spell reflexes, but
Fingers and X.
yeah. Circulation, so like the cap refill is like the fingernail, like then you like see how quick like your normal skin color comes back, and it's supposed to be like 3 seconds is like healthy. And then range of motion and pulses. So, and then once you're done with your head-to-toe assessment, you want to like look over the results, and then if there is something wrong, you want to look at like treatment plans, and then the next medical step would be like vitals. And like you don't need to do a head-to-toe assessment every time you see a patient. It's more like the first time you go to the doctor for the first time in like 5 years, or like a new doctor. That's when you do it.